So today I'm going to be showing you a to P adjustment for first rib. I think I scared Daniel there with these big man paws. Rotate up, and we want to think about creating space. Probably sit. Swing the leg around. Look at this little foot, and we think of a bunion having a little kick, right? So we're going to show the assessment first, and we're going to show this adjustment, which can be a less aggressive way to adjust somebody's first rib versus our typical maybe prone or supine or seated versions, which those are all great versions. I would particularly use this, somebody that's fear avoidant to being adjusted in a seated position, and then also just certain body mass issues. This can also be a lot easier, especially if you're a smaller doctor working with a bigger patient. So when we're assessing first rib from a motion palpation standpoint, we're going to kind of use this hand to assess the right first rib, and we just kind of let his head drop in a lateral flexion, and then we kind of give a little overpressure, and we're trying to see, does that first rib work like the bucket handle or that pump handle that it's supposed to? So if his head goes into lateral flexion, we should feel that drop away. Now if we bring it away, we should feel it kind of bump up into us. And on Daniel, a little bit of restriction on the right, and then if we're checking the left, a little bit better. And a really good way to assess this too is also breathing. So if we have him taking a really big breath, and he's not going to do his great diaphragmatic breath, so he's just going to breathe, you'll really feel sometimes that first rib just elevate right into you, which is normal, right? But then we want to see, does it move on inhale, exhale? So now let's show the adjustment. So Daniel's going to go supine, and I'm going to go over these positions a little bit. Now this is where male to female doctor or female to male doctor, be very cognizant of how you explain what you're doing and be very upfront, because we're going to take the patient's hand and cross it and put it right under their clavicle. I have enough room between his hand and his clavicle to get my hand in there. So if I look anatomically, I'm going to be on the anterior portion of that first rib. So what we're looking for here is I'm going to try to kind of create a inferior traction and get that first rib to move into that kind of flexion or pump handle action as I apply A to P force. So a lot of times we're going to get multiple cavitations. We're getting a little kind of T1 through T3 extension as well, which is probably necessary for that action to occur anyways. So again, turn, we ask the patient to turn their head towards the doctor. Now here I always say, give me a bro hug, right? You give whatever cue you want, but if we get that patient to hang on to us, now we can roll them very easy. And what I want you to see is I'm going to use my kind of pad in between my first MTP there, and I'm going to put that right in between his spine and more or less the superior notch of the scapula. And that's right where that first rib is going to live. And before we do anything here, all we have to do is a little bit of drop. So it's just a little drop, and we got that first rib. Now we can come over and do the other side. So we're going to come in here, we're going to ask the patient to turn. We're going to have Sloan come in really close. We're going to have them give us a bro hug, and again, to look where we're at. So we got kind of T1, T2, we're putting that fleshy pad right in between those two. So we get a little bit of that extension with that first rib and a little drop, and we get that first rib to move there. And then we sit the patient back up. As we're all taught to do, we reassess to make sure that we actually implored some motion into that joint. And that is your supine first rib adjustment.